My name is Dr. Eric Fanaee. I am an interventional pain management physician practicing at Long Island Neurosurgical and Pain Specialist for 6 years. My residency training occurred at University of Chicago in the Department of Anesthesiology. I then pursued fellowship at New York University in the subspecialty of pain medicine. I'm double board certified in both anesthesiology and pain medicine by the American Board of Medical Specialties. I'm here to talk about one of the most commonly overlooked sources of back pain that I see, and that is SI joint dysfunction. The sacroiliac joints are joints located to the right and left of the lumbar spine. This is a very large joint and it takes a lot of force. When we walk, we generate a lot of force. That force is then transferred to our pelvis and then to our spine. The sacroiliac joint functions as a shock absorber. All different types of things can happen to this joint, which makes it a source of pain in some people. So anytime a patient comes into the office, the sacroiliac joint is always on my mind as a potential pain generator. Many of these patients will present with pain on one side or the other. These patients will often point to the area consistent with the sacroiliac joint, but oftentimes because of the location of the joint, the patient may feel the pain somewhere else. The sacral nerves will become soaked in inflammation essentially, and patients will complain of leg pain, numbness and tingling in the leg. Pain that is there with prolonged sitting is a very strong clue that the sacroiliac joint might be involved. Another common complaint is pain upon going either up or down stairs. Pain getting up from a seated position is a very strong clue. Imaging studies are great, physical examination is great, but if we sit down and talk to our patients and listen to them and take the time to get to know their situation, the diagnosis is almost clear just from that interaction. Those patients who have failed traditional treatment, which may include physical therapy, chiropractor, time, rest, judicious use of anti-inflammatories, potentially pain medication as well, the next step would be an intervention. So there's different types of interventions that we can do for the patients. The simplest intervention is a diagnostic sacroiliac injection. If a patient gets initial relief, but then it wears off, that's a very strong indicator that the sacroiliac joint is indeed the diagnosis that we've suspected. That's a case where the iFuse system can be very beneficial. Considering the fact that sacroiliac joint dysfunction and pain account for about 15 to 20% of back pain, there's a lot of people out there who could benefit from this procedure, especially if they've failed conservative and interventional treatments and they still continue to have pain. This procedure is minimally invasive, minimal downtime, 3-centimeter incision, and these patients are going home the same day. This procedure has been available since 2009, and there is a lot of high-level evidence supporting its use in selected patients. My goal is to make patients as functional as possible, utilizing the most minimally invasive procedures in a manner that's safe and comfortable for each patient. If you have questions, please give us a call or visit our website.